Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar where we talk about Lyme disease. And as you know, those of you that are returning, you create the webinars each week with your questions. For those of you that are new here, welcome. I'm glad to see new faces. And I also see that we have a number of regulars or people that continue to get some value and that keep showing up. So I'm glad to be able to help you as well, too. The way that you can write questions to me is over here on the bottom of the screen on the right-hand side is a chat box. And you can use that chat box to write your questions to me. I ask that you kind of keep those questions short. This forum, it works well for shorter questions. Long questions get very difficult for other people to follow. And sometimes I'll actually freeze my computer screen when I try to post them. So during the live version of the webinar, those of you that are participating will actually get to see the question on your screen as I post it in a way that you could read it. In the recorded version, though, it doesn't show up. So I will read each of the questions as well, too, so that in the recorded version, especially, that people can follow what I'm going to be talking about, okay? I am creating a recording of tonight's webinar, and that is as if things go as they're supposed to. I'm creating a recording. That recording should be ready somewhere between 8:30 to 9:30 in the morning Pacific Standard Time, Seattle time, tomorrow morning. So keep a lookout for that too. If you happen to miss some information tonight, just realize I am trying to create a recording of that. And 99% of the time that recording works, and about 1% of the time, for some reason, YouTube that's supposed to be doing the recording doesn't record it correctly. So anyhow, if everything goes fine, we should have that. Tomorrow morning, also, when you get that email, there'll be a link that you can use to sign up for next week's webinar. This is the first of 3 in a row that I'm doing. I call this the July series, and so tonight, next week, and the week after that. All right. So without any further ado, let's go ahead and get started here. Hello, S. Let's see, I've been using the organic wild oil of oregano and olive oil from North American Herb and Spice. Dr. Cass Ingram speaks highly of it. Is the oregano on your website more potent than this? On a different note, have you found tryptophan useful in Lyme and co-infections? And do Ehrlichia, Anaplasma, and Rickettsia cause joint pain? All right, let's start with the last one. So, do Ehrlichia, Anaplasma, or Rickettsia cause joint pain? I usually think of Rickettsia as doing that. I tend not to think of Ehrlichia and Anaplasma as doing that as much. Usually I think of them as causing more muscle pain, all right? So everyone, those are other tick-borne infections. The Ehrlichia and Anaplasma we tend to consider as co-infections, other infections you get when Lyme is transmitted. The Rocky Mountain spotted fever can often be transmitted on its own, okay? In terms of the oregano, I can't tell you if the liposomal oregano that I sell on my website, which is manufactured by a company called Doctor Inspired Formulations, is any stronger or less strong than this other one. There's not been any head-to-head studies that have been done. My main point as I talk about using oregano, and many of you may be familiar, I've been talking about it on some of these webinars, but also I republished my article on how to treat Bartonella, republished it about 2 weeks ago. I'll probably show that to you tonight too, but if you haven't seen it, go to treatlyme.net and type in Bartonella, and you'll see my massively rewritten, re-updated article on how to treat Bartonella. One of the things that I'm noting in there is that you can use oregano oil, and I suggest a liposomal oregano oil. And the reason I suggest liposomal is liposomal means it's microscopically wrapped in fat to increase its absorption. Oregano oil has got some studies showing that it can help with persister forms of Bartonella as well as persister forms of the Lyme germ. In addition, it can help with biofilms as well too. It can help break them down, okay? So to kind of summarize that a little bit, traditionally the medicines we've used to kill Bartonella have been focused on treating growing forms of the germ. We now know, based on some research that was published in November, so this is real new research, research that was published in November of 2019, that Bartonella actually has the ability to develop what are called persister forms too. So there's growing forms and then these things called persisters. Persisters are a form of the germ that basically slow their metabolism down way, way slow and go into hibernation. And in the hibernating form, they can ignore the regular antibiotics. So in looking at some of the Petri dish experiments about what you can do for this, because we don't have human studies yet, but Petri dish experiments suggest that oregano oil, liposomal oregano, is one way that you can deal with that. My experience is in working with the liposomal oregano oil from doctor-inspired formulations, and using that, I am seeing success in my practice. I cannot speak to whether this other product that you mentioned here makes any difference at all or not. Let's see. And then you asked on a different note, have I found that tryptophan useful in Lyme and co-infections? So tryptophan is something I might use to help with sleep, and I might use to help with depression. I haven't used it in any other form in terms of treating Lyme disease. All right. All right, so let me do a quick screen share here, everyone. I just want to show you the article that I mentioned about that has information about oregano oil in it. All right, so this is my Lyme disease information site, which is Treat Lyme by Marty Ross MD. I think many of you are familiar with it. If you're looking at how to address any situation you might have in Lyme disease, start here by looking at this tab right here, which is my online Lyme guide, where I have written, I think, over 120 articles on topics that you can use to help with your Lyme disease care. Most of these articles have both prescription and or herbal options in them as well, too. So take a look at my section called Infection Treatment Plans. And take a look at my rewritten article called Kills Bartonella, a Brief Guide. And this is a significant rewrite of this article. And you can take a look where I talk about persister forms and what to do about it, okay? Right. If you're ever wondering what I've done, first of all, to find out when I post new articles, you could sign up for my email list that you can do on this website, okay? The other thing you can do is go to the website and under this tab called The Latest, just periodically check in and see what I have posted that is a new article. So my newest updates are 3. There's this one on Bartonella treatment, another one on using dapsone to treat Lyme persisters, and finally my recent thinking about when and why you might need to treat for the MTHFR detoxification abnormality. This is a new article as well, too. All right. So let me go back here again. All right. Thanks for the question, S. Good luck to you. Hello, Isa. Let's see. Hi, Dr. Ross. My friend has been following your protocol and advice for treatment of his Lyme Bartonella since January. We have been feeling so much more optimistic about his prognosis since we started working with you, despite the fact that he hasn't yet shown much improvement. A few months ago, you said on the webinar that you have been able to help about 90% of your patients get better, but that the improvements could be anywhere from 5% to 100% recovery. To be honest, this was a bit nerve-wracking. We very much appreciate your honesty, but I'm wondering if you could provide some anecdotes or words of encouragement for those of us who struggle to hold on to the hope that we or loved ones actually can get better. Thanks, as always, for your generous help. So I mean, I have to understand, I understand that would be discouraging, that when I say you can get better, but then I say that it ranges from 5% to 100%. The problem is it's such a complex illness that some people do get great recovery and some don't, and there really are no ways of predicting. I have had patients, for instance, in my practice that came to see me that had complex Lyme and co-infections that they had for about 20 years, and within 6 months of using antibiotics they were 100% well. That happened one time. The average person, though, that has this for multiple years is probably talking a year to 2 years of treatment to recover. Some people shorter, some people longer. But besides giving that one example, I would hang in there. If things are not really rapidly improving for your partner or your friend, then it may be time for us to relook at things again together in the form of doing a visit. Okay? All right. Good luck to you. Hello, Megan. See, how long do you have to be symptom-free to know that you're over Bartonella? Generally, I like to be symptom-free for at least a month. I feel better if it's 2 months, but at least a month. All right. Good luck. Hello, Luke. Let's see. Hey, Dr. Ross. Thank you for what you do. You're welcome. From your clinic experience, have you had patients complain of a weak neck, not painful, just weak and stiff at the occiput of the neck? Is this the arthritis of Lyme or Bart? I feel like the neck is the driver of my symptoms, ringing in the ear and the constant heavy head feeling. It's very positional. It's worse when standing. I feel more pressure in the upper cervical area. I am Lyme, Afzeli, positive for Mygenics. Thanks. So, Luke, there's a lot of variety of symptoms that people have. I have not had somebody that had this specific type of neck complaint that you have. I can tell you probably most people that see me, there's something unique to them about their specific symptom, although most people are going to have some degrees of fatigue, cognitive impairment, muscle and body pains, and some neurologic dysfunction. Those are the common ones. So anyhow, what I would say is no, I haven't quite seen this, but it would fall definitely within the realm of what Lyme can cause. All right. I don't think it sounds like a Bartonella symptom, though, if that was the other part of your question. Thank you, and good luck. Hello, Dave. Let's see. Good evening, Dr. Ross. I'd appreciate your opinion. Let's see. My Igenics Lyme IFA serum result was 40, which is equivocal. Immutable IgM was negative for both CDC and Igenics Lyme. My IgG for Lyme was negative for both CDC and Igenics. Seeing these results, would you say I need treatment for Lyme? Let me go back here just a minute. Okay, so in terms of the Lyme question that you asked here, there are 4 things to determine whether you might need treatment or not. You cannot diagnose Lyme just by a Lyme test alone. So you could have Lyme testing, for instance, and that's positive and have no symptoms of Lyme. And I would say that doesn't mean you have Lyme disease because you don't have any disease. You don't have any symptoms of it, okay? It is very possible we can develop immune reactions for which our immune system actually takes care of a condition, for instance. It's also possible without symptoms that a person has a false positive test too, all right? When I make a decision to treat Lyme, there's 4 things I consider. And they're all, we put them together, it's like building the pieces of a puzzle. All right, so number 1, a person to have Lyme, we need to consider what's their risk of getting it. So for instance, a person with a known tick bite in New Jersey, where 95% of ticks carry Lyme, there's a good chance they might have gotten Lyme from that tick bite. If 50% of the time that somebody has Lyme, though, they don't remember a tick bite. And so we have to consider, are there other risk factors? Like earlier today, I talked with somebody that doesn't remember a tick bite, but he's a deer hunter. And so that's a risk. He could have had exposure to ticks and had a bite and just doesn't know that he got bitten, for instance, okay? Other things to consider, there's the possibility, although I think it's a small possibility, that Lyme could be sexually transmitted. Excuse me. Lyme may be spread through, or about 50% of the time that a woman is pregnant and she has Lyme and she's pregnant, there's a 50% risk it could be transmitted that way. We also wonder, I wonder, based on the fact that 50% of the time that people have Lyme, they don't remember a tick bite, we do wonder if there are other vectors. So for instance, there are studies out of Poland that show that mites, fleas, biting flies, and mosquitoes can carry the Lyme germ. Doesn't prove they transmit it, but we do have other vectors that carry it. And so when 50% of the time people have Lyme, they don't remember tick bite, you got to wonder if something else is spreading it as well too, okay? So anyhow, we still consider risk, all right? So you've got the biggest risk would be a known tick bite in an area where there's lots of Lyme, okay? Number two, we look at, do you have enough symptoms that look like Lyme disease? And if you have a lot of them, even if you have negative testing, you might still be treated for Lyme. And if you have negative testing and high risk of getting it from activities that make you run into ticks, for instance, all right? Third thing we look at is, are there any physical exam findings? And then the fourth thing we consider is, do you have a supportive test? You cannot diagnose Lyme disease just based on a test, nor can you exclude having Lyme disease just based on a test. So your test could be negative, which happens about, can happen up to about 15 to 20% of the time that somebody has Lyme, but you could still have Lyme. So if you have a high risk factor and a lot of symptoms of Lyme, even with negative testing, I might still call it Lyme disease. Regarding the test results though, and again, I can't answer whether you have Lyme because I don't know what symptoms you have, okay? And I don't know what risk you have of having acquired Lyme either. But the testing, I would say this is indeterminate testing that leans on the positive side. So having antibodies on this IGeneX immunoblot against protein 31 could indicate that you have Lyme, but it would definitely need to call it fully Lyme. I would need to see a positive on one of the other bands. So I would say you have indeterminate, almost positive testing. But again, you got to consider what the symptoms look like. You got to consider the physical exam findings, and you have to consider, is there a risk you could have even gotten it? Okay. All right. All right. Number two, let's see, you have a second part to the question here. Let's see, seeing these results. Okay, I think I answered that. Secondly, my Galaxy BART enhanced PCR test reads not detected all across the board, while my Galaxy BART IFA IgM serum results are both reactive at 1 to 64 for Bartonella henselae and Bartonella cantana. So in your opinion, do I have BART hiding somewhere? Okay, and so in terms of that part of the question, I can't tell. I would need to ask you a lot of things about symptoms. And I know you list some symptoms further in your question. I would need to ask you a lot more things about your symptoms, all right? So first of all, the antibodies that you tested positive for through the Galaxy lab are IgG antibodies. There's two families of antibodies we develop when we get infected with something. There's IgMs and IgGs. IgMs are what we develop during an acute infection, and they eventually get replaced by IgGs. Once we make IgGs, they serve as the memory of the immune system, even if the immune system got rid of the infection, all right? So your IgG levels are barely detectable here at 1 to 64, which could be that it's an old infection that your immune system dealt with. Regarding the Galaxy enhanced PCR part of your testing, that is a technique we use to see, is there the DNA of the germ in you? And at this point, Galaxy has not been able to tell us what the ability is for their enhanced PCR to actually pick up Bartonella. The issue is for that test to come back positive, you would have to have Bartonella swimming in front of the needle once the germ, once we're trying to draw the blood. Bartonella lives inside cells, and it's not clear what percent of, how effective is their enhanced PCR at actually picking up Bartonella when somebody has it. When it does come back positive, it truly means you got it in you, but it may miss a lot of cases actually, okay? Hold on here, everyone. I've got some lighting issues, just a minute here. There we go. was starting to get so I'm in Seattle and we were starting to get sunshine. It was starting to blind me in my eyes there just for a minute. Anyhow, I think that'll work better. Let's see. My symptoms are some joint pain, a few liver cysts, and frequent intense abdominal pain close to my diaphragm since gallbladder removal 2 years ago. Confuses how to proceed, and appreciate your thoughts. So I would need to know a lot more things from you. I would need to know more about what your risk of possibly having run into a tick. I would need to ask you a lot of questions about symptoms. These symptoms and problems you're having in and of themselves do not say Lyme disease or Bartonella to me. That doesn't mean you don't have them though, okay? If you want my opinion, I would suggest that you set up a consult visit with me. I do have a way of visiting with people online and giving an opinion. Let me show you where you can go to look at whether you want to do that or not, okay, and what it would entail. And this is for anyone. Anyone can set up a consult visit with me. So I'm going to do a quick screen share for this. Okay, so this is back at my Lyme information site. If you want to know where to get the consult set up, though, you need to look at my practice website. So you can reach the practice website by clicking this clinic link right here, or you could go to my practice website, which is martyrossmd.com. Take a look at the types of appointments and visits I offer on the appointments page. And you want to scroll down here to this section right here where I describe what I call my full medical service visits, where I can prescribe for you, and I describe my limited consult service too. In here, I talk about what I can do in these visits, what I can and cannot do, and there's information about the cost as well too, okay? So take a look there and see if that's right for you. If you do decide to do it, you can literally book your appointment by just clicking on that Book Now button. All right. All right. Good luck to you, Dave. Hello, Geraldine. Could the effect of post-Lyme treatment syndrome be similar to the long-term inflammatory problems that are occurring after infection with COVID-19? So there are, I don't know if I'm going to be able to answer this directly. So there are a number of people that have COVID-19 or had COVID-19 that are just having horrible times recovering. They have problems with breathing that continue. They may have problems with heart beating irregularities. They may have some dysregulation within their adrenaline, anti-adrenaline system. So they develop POTS, for instance. They may just have ongoing severe fatigue and cognitive dysfunction. So I think, Geraldine, what you're asking is that similar to what we're seeing with Lyme disease as well, too. There is one commonality that may happen in both Lyme, chronic Lyme, post-Lyme disease syndrome, and in COVID-19 where people cannot recover, and that is there may be ongoing overproduction of excess cytokines. So those are inflammatory chemicals that get made by the immune system in trying to repair itself and get rid of an infection. And if you have excess cytokines, they make it so you can't think, they give you fatigue, they disturb your sleep, etc. So that may be one thing that post-Lyme syndrome and COVID-19, post-COVID-19 syndrome, where people are having a hard time recovering, have in common, okay? The other thing that could be in common is both Lyme, having had chronic Lyme, and having had COVID-19, both of those conditions may lead to some injury to the cell energy factories called mitochondria. If the mitochondria get injured, somebody's going to have a hard time developing enough energy for their cells to recover, no matter what organ or system has been injured. So that's another thing that may be uncommon between Lyme and COVID-19. Both Lyme and COVID-19 may also trigger mast cell activation syndrome, and they may also have problems of what's called the vasovagal system, the part of the nervous system that regulates adrenaline and anti-adrenaline. both of them can trigger imbalances there. Beyond those similarities, what is happening with COVID-19, we fully don't know yet, other than being able to describe we see some of these problems. And then in Lyme, we know that part of the reason people can remain ill in Lyme is they continue to have the infection, and they have dysregulation created from having had the infection. Okay. All right. Thanks for that question, Geraldine. Hello, Thomas. Let's see. Do you suggest or recommend enemas for detox? And are there any risks or concerns such as disturbing the colon flora? Have you read about or have any experience with any of the supportive or antimicrobial peptides? What's your take on bee venom therapy? All right. So regarding enemas, the only time I really recommend enemas is in somebody that's not having regular bowel movements. If they need that to have regular bowel movements. So part of detoxing, there's two major organs involved in detoxing. One is your kidneys, and the kidney is what's responsible for removing water-based toxins. The other major organ that's involved in detox is the liver, okay? And the liver is responsible for taking fat-based toxins and converting them into water-based toxins by adding a water-soluble chemical group to these fat-based toxins. Those water-based toxins and these transformed fat-based toxins to water-based toxins get moved out into the intestines, and they mix in your poop and you poop them out. However, if you're not having daily bowel movements, for instance, one of the things that can happen is the bacteria that line the intestines have the ability to break off these water-soluble chemical groups that were added to the fat toxins. And when they break them off, these fat toxins then are free to get reabsorbed again, so you can't get them out, okay? So the one situation where I really do promote and believe in doing enemas, whether it's coffee enemas, saltwater enemas, any kind of enemas, is if I've got a patient where is not having bowel movements, and no matter what I've done to get them to have bowel movements, whether it's using magnesium or it's using stool softeners, whatever it is, if we can't get them to have regular bowel movements, then and only then I might recommend doing enemas. I do believe there is concern with anything that you put in your rear end or your intestines of disturbing the microflora, the good bacteria. And I believe that even there is that risk to a small degree, not a large degree, but to a small degree by doing enemas as well too, all right? In terms of the antimicrobial peptides, I'm still not sure they really make a difference, nor am I sure that they do make a difference. So I don't have an opinion. I haven't seen enough data that says people really get help by doing them. And so I'm not necessarily saying they do or do not work, okay? And let's see, my take on bee venom therapy. So bee venom therapy, I have a whole article written about that. And actually, rather than taking the time to discuss it here, let me show it to you. It could be that bee venom therapy is helpful with inflammation. There are some people that believe it may help as an antimicrobial. I don't think it does actually. But let me show you the full article. You can read more about the science behind bee venom therapy and even how to do a session of bee venom therapy too. All right, let me do a quick screen share here for that. All right, so take a look back at my Lyme information site, the Treat Lyme by Marty Ross MD, and take a look at, I think I have an article, I think it's under anti-germs. Yeah, there it is. Bee venom therapy for Lyme. Okay, so I have this article about it. If you can't, if you're unable to find it, but what I just did, just type bee venom in here in the search bar, okay? All right. All right, thanks for the question, Thomas. Hello, Joyce. Let's see how Dr. Ross. In 2016, I was diagnosed with Lyme and Bartonella. I was on minocycline, and it looks like, Joyce, we got a wandering part to your question here. Just trying to see if I can find it anywhere here. Joyce, the second part did not come through. So I'm sorry, obviously I don't know I don't know what the question is, so I can't provide an answer at this point. All right. Hello, Tracy. Let's see how Dr. Ross. Several people on a Buhner forum complained of developing tendon sensitivity or rupture while using cat's claw. Have you seen this in your practice or heard about it? And does Lyme or coinfections suppress the IgA immune system? What other things might suppress it? So first of all, in terms of tendon pain or tendon rupture, I have not seen that to happen on cat's claw. I'd be interested in if Buhner has seen that as well too. I'd be interested what his response was to that, but that is not something I have seen while on cat's claw either. And I use lots of cat's claw in my practice, and I've been doing so since probably 2007, so a number of years. So I have not seen that develop. And then in terms of IgA, when in terms of antibodies, I mentioned earlier that when people develop infections, there's two antibodies they develop. There's actually can be a third one, but the main ones that actually fight the infection are IgM antibodies and then IgG antibodies. There's another type of antibodies we can develop, which are called IgA antibodies. And these are antibodies that will develop after you've been exposed to something, and they attach themselves to the mucous membranes in our body. So our nose, our lung passages, and in the intestinal tract as well. And they're a part of our adaptive immune system that are there ready to grab hold of germs that we don't want to have there, okay? But the body has to have seen these infections before to develop the IgA antibodies. In terms of what might suppress it, I actually don't know off the top of my head. I'm sorry, I don't have a good answer for you on that one. All right, and thank you for that question. Hello, Thomas. Let's see. Do you treat liver parasites first, during, later, or never? What causes low antibody levels of mold, fungus, virus, bacterium? And does that make us noticeably vulnerable to lymphoma, leukemia, myeloma, etc. during Lyme infection? And what's your take on IV infusions of glutathione, NAD plus curcumin, Myers cocktail, okay, etc.? Thomas, that's a lot of questions. So let me try to go through these first real quickly. So liver parasites I would treat if a person is symptomatic and you can prove they're there. All right. And so I'm not a big believer in just treating for the possible idea of parasites unless we have some evidence that they're there. I will occasionally treat for intestinal parasites under the idea that they could be there, but only if we've got symptoms that suggest it. So if somebody's got a lot of diarrhea or cramping pain, and they've done international travel where they might have been exposed to parasites, or they've drank from well water where they might have been exposed to parasites. In those kind of situations, I might treat for parasites. I know that there are others out there, like Dr. Dietrich Klinghardt out here in the Seattle area, that is now promoting the idea that parasites cause all kinds of health problems and that you can have them in your blood and you can have them throughout the body. And I don't buy it. I don't see that as a problem. The only other parasite that it will treat in Lyme disease is Babesia, the co-infection. Babesia is a blood parasite, and we do have evidence that that can lead to some problems as well too. Let's see, what causes low antibody levels? So immune suppression can lead to low antibody levels. Let's see, and does that make us noticeably vulnerable to lymphoma, leukemia? and myeloma. I don't know. I would not consider myself to be an expert on lymphoma, leukemia, and cancers. And I'm not sure that having low antibodies is or is not a risk factor for that. Okay. All right. Thanks for the question, Thomas. Good luck. Hello, Lapman. Let's see. Hi, Dr. Ross. Right now, I'm taking 4 pills of Malarone, and I'm still not able to control the Babesia symptoms. What should I do? I have lost 20 pounds in 3 weeks. So the fact that you've lost 20 pounds in 3 weeks, I would say it's time probably to talk to your doctor. That needs to be explored as to why you're losing weight. In terms of, are there other things you could take in addition to Malarone? Yeah. And it could even be if you're losing weight because you've lost your appetite, sometimes the atovaqone, which is part of Malarone, can lead to appetite suppression. And so you need to talk to your healthcare doctor about this. This one I'm not going to give you direct advice because I want you to go back to your physician to say this is what's going on, to help figure out what's going on with that weight loss first. Is it a side effect of your medications? Needs to be explored. There are many options you have to treat Babesia, but I'm going to leave it up to your doctor to take care of that with you, okay? In terms of my ideas on how do you treat Babesia, you could take a look at my article on that, and let me show you that real quick. All right, so in terms of options to treat Babesia, take a look at my Lyme guide, go into the infection treatment plan section, and you can scroll down to this article I've written about how do you treat Babesia, what options do you have, okay? If your doctors and you decide that it is the atovaqone that is suppressing your appetite leading to weight loss, then you would not want to take the Malarone, and you would not want to take Mepron, which is all atovaqone. But the other options in here are things that you could take a look at. All right. Hello, Lisa. Let's see. Hi, Doc. I read that EMFs cause mold to produce 600 times more toxins than usual. Please share your thoughts about this. Thank you for having these webinars. God bless. I have not seen any linkage with that. I am not aware of that linkage. I have not seen an article describing that. I'd be got to take a look at the article you've read so I can decide if I think it's valid points that they raise or not. I would want to make sure that it's just not somebody's opinion. As you know, in the world of Lyme, there's tons of opinions out there, but I try to stick to ideas and things that are a little bit more rooted in science as well too. If you want to share a link to that article, I'd be glad to take a look at it and give you a comment. My email is docmarty, DOCMARTY at Marty Ross, that's MARTYROSSMD.com. All right. Thanks for the question. Good luck. Hello, Brandy. Let's see. Do you treat children? My son is 9 years old and has bart marks on his legs. Yes, I do treat children. My background is that I trained as a family physician. At one time, I was board certified as a family physician, and I did family practice. That was before I made the shift over to doing integrative medicine. But I still am trained to work with kids, and I work with children and teens as well as adults in my practice. So the answer is yes. Thanks for that question, Brandon. Let's see here. Hello, Lynn. Let's see. With COVID supplements, can you please explain how anti-inflammatories to curb cytokines are modulated so that there is still an appropriate immune response, i.e. some cytokines? Also, with immune boosting supplements, don't they increase cytokines? And how are they modulated to produce the right level of response? Seems like the two counter each other, so it is confusing to understand. Thank you for clarifying how this works. Also, I read on Dr. Andrew Weil's website that beta-glucan elevates the same cytokines as are the bad ones in COVID. So to avoid that supplement, which is found in transfer factor multi-immune. Thank you so much for doing these webinars. So Lynn, all good points, all valid points. And the truth is Dr. Weil doesn't know because no one's done the studies to say, do beta-glucans hurt the outcome with COVID-19, okay? All right, in terms of beta-glucans, those are sugars that are found in mushrooms. Although Dr. Weil may have pointed out the cytokine effect, they also have evidence that they actually improve the function and the numbers of the type of white blood cells that would be needed to fight the infection, not necessarily increase cytokines, but actually help better functioning of those immune cells. And those immune cells would be phagocytes, would be macrophages, would be dendritic cells, and natural killer cells. So beta-glucans seem to improve their functionality. As to whether they actually increase cytokines that could hurt a person, it's hard to say. But at this point, it's hard to say because no one's done those studies actually, okay? My thoughts on what to do regarding the immune system is to support what is known as the innate immune system. The innate immune system is that part of the immune system that fights a germ that the immune system has never seen before. It is composed of different types of immune cells, including natural killer cells, and including macrophages, phagocytes, and dendritic cells. And my thought, as I looked at this, was to increase the functionality of those cells and possibly the numbers. You could do that by being on reishi mushrooms. You could do that by being on transfer factors that increase the functionality of natural killer cells. Now, as to whether that actually will lead to hyped up cytokine production, it is my sense as I looked at the literature that probably would not happen. Obviously, Dr. Weil has a different sense, which shows you how much we do or do not know for sure in this illness, okay? My thoughts then also about cytokines was to do things in terms of wanted to make sure that we've limited overproduction of cytokines. So if you notice in my article I wrote about COVID-19, I suggest that if somebody has COVID-19 to do things to decrease cytokine hyperproduction. All right, so the things I recommended, which would be things like glutathione or doing curcumin, will decrease cytokine production, but they don't knock it out. You're still going to get adequate production so that your immune system can be recruited to actually fight the infection. It would likely work, though, to help limit the cytokine surge that people can see. None of these things that we use to limit cytokines actually knock out the complete cytokines response. They're limiting the overproduction of cytokines. So you raise a good question. I still think that there is enough production of cytokines that would occur on any of these to still allow the immune system to work correctly. All right, those are my thoughts on it. I mean, obviously somebody needs to go out and do the research on some of these ideas to see if they're going to make a difference. But because this is a COVID-19, a novel virus, the novel coronavirus, it means we just still don't know a lot of stuff. Dr. Weil has an opinion. I have an opinion. And in the end, who knows whose opinion is correct? Okay. All right. Thanks for that question. Hello, Mary. Let's see. When is it ever safe to stop mast cell treatment, or should you remain it for the rest of your life? What happens if you discontinue it too soon? Okay. So I think what Mary is referring to is the treatment for something called mast cell activation syndrome. And let me talk about that. And then I'll answer your question after I talk about that. So mast cells, everyone, are a type of cell that historically we thought were only involved in people that had a lot of bad allergy type symptoms, or they were the allergy cell, okay? So what happens with the mast cells, inside mast cells are where histamines are made. And if you're allergic to something, it would land on a mast cell after it attaches to a type of antibody called IgE antibodies. And they land on a mast cell, and that causes the mast cell to release histamines. And those histamines can give you things like hives. They might give you watery, itchy eyes. They might give you nasal stuffiness. They could even trigger bad allergic asthma type reactions as well too, okay? We now know, though, that these mast cells can become activated and triggered by chronic infection. And so people that have Lyme sometimes develop these really sensitive, hyped up immune systems that probably come about from Lyme turning on their mast cells to be more easily aggravated by the foods we eat or things in the environment, okay? All right. So the other thing that also appears to turn on mast cells would be toxins, and finally, stress and anxiety. One of the biggest triggers of your mast cells is stress and anxiety. All right. Now, if it is infections triggering your mast cells to be active, presumably once you get rid of those infections and get the immune system rebalanced from having had those infections, you may not need to be on mast cell things to regulate your mast cells forever because you get rid of the stimulus. Likewise, if anxiety has been a big trigger for your mast cells, if you learn to do things like meditation, or you develop relaxing things in your life like doing exercise or having a therapist, anything you do to deal with stress, once you remove that as a stressor, your mast cells will start to quiet down. If you've had mold toxins that have been triggering your mast cells and you remove them, those mast cells are no longer being triggered by the mold toxins, okay? So if you have mast cell activation and it is the end result of having Lyme, mold toxins, stress, maybe yeast overgrowth in your intestines, and you correct all those issues, eventually you're not going to need to take supplements that target stabilizing the mast cells, in theory, okay? All right, so what can you use to target and stabilize those mast cells? Well, number one, de-stress. Okay, that's like one of the most important things. Number two, take things out of your diet and out of your life that you know are leading more to those allergic reactions. Like if it's dairy and you suddenly get hives after dairy, don't have it. Or if you get a stuffy nose after dairy, don't have dairy, okay? If there's certain environmental toxins you know that set you off, then you shouldn't have those as well too. You also want to treat your infections, whether it's Lyme or yeast, treat those. And then there are specific supplements you can take that stabilize your mast cells. And the two big ones are something called luteolin, and you would want to take at least 100 milligrams 3 times a day of that. You can also use quercetin, which is a chemical that comes from onions. It's a bioflavonoid, and you would want to take 500 milligrams 3 times a day of that. In addition to using those mast cell stabilizers and de-stressing and treating your infections, sometimes you have to take antihistamines, like a Zyrtec, for instance. Sometimes you have to take stomach acid reducers because they have another effect of being histamine blockers as well too. So things like Tagamet, for instance, okay? And sometimes if you have a lot of inflammation from all of this histamine release, we need to put you on something called Singulair to decrease inflammation, all right? So there's a variety of things that you can take to stabilize your mast cells and deal with the reaction. But ultimately, if you get rid of the things triggering those mast cells to be active, by decreasing stress, by treating your infections, by removing the things that you are reactive to in your environment, they'll quiet down and you can stop taking all the supplements that you've been using to control that, okay? All right. Thanks for the question. Good luck. Let me show everyone an article that you can read to get more information about this too. All right. So back at my Lyme disease information site, take a look at in terms of mast cell activation. What section would I have put that in? Oh, heck. I'm going to look up here. I'm just going to type in mast cell. All right. So this is my article on mast cell activation. I describe what causes it. I also describe in here what systems it affects and what the symptoms can be of it. And then finally, I talk about how you can test for it, although testing is pretty poor. Sometimes you just have to treat based on what the symptoms are. And in here, I talk about the approach you can use to deal with it as well, too. Okay? All right, so it's my article on mast cell activation syndrome in Lyme. All right. Good luck to you. Hello, Dorlinda. Let's see. My husband was diagnosed with ehrlichiosis on May of 2020. He's 68. He was sick 17 days before he was diagnosed when he was released from the transplant unit 2 days after diagnosis. They sent him home with the remainder of a 10-day script of doxycycline. I then reached out to another doctor in my area that then put him on transdermal antibiotics for 2 months. He is nearing the end of the 2 months. I'm confused if he should continue on with more antibiotics. I've been told that ehrlichiosis is not chronic. What are your thoughts on this? So I can't tell you specifically what your husband should do because I obviously don't know enough about his specific health situation. I can talk about Ehrlichia, and which causes ehrlichiosis. It is my opinion, and based upon my practice results I see too, is that Ehrlichia is fairly easy to take care of with 2 to 4 weeks of using doxycycline. Okay, I haven't found it to be something that becomes chronic. That's been my experience. All right. All right. Thanks for that question. Good luck to your husband. Hello, Clara. Let's see. I've had Lyme disease for 7 years. Always have shoulder and foot pain. I have had to stop playing tennis and biking as the pain is severe. So if you're asking, will you always have shoulder and foot pain with Lyme disease? The answer is maybe, but probably not. I would need to know a lot more what's going on symptom-wise to figure out, and I would need to know what you've done for treatment. But often with treatment, with antibiotics, either herbal or prescriptions that go after the infection, often that inflammation that's leading to the joint pain will go away. There are some situations, though, that you can get into permanent injury, but the chances of something being permanent usually is quite small when it comes to joint pains. If you have treated for a number of like a year or two, for instance, for your Lyme and you are still having joint pains, one of the things I have found helpful is to try to rebuild the cartilage in the joints. Sometimes having had Lyme can lead to injury or destruction of the cartilage, and sometimes repairing it can make a difference for that ongoing joint pain. I like to repair cartilage by using something called glucosamine sulfate. It's a 500 milligram pill, and you would take 3 times a day. I would also couple it with something to decrease inflammation in the joint, and I like using curcumin to do that. I like using a variety of liposomal curcumin, product by Thorne called Mariva 500, and that's 1 pill 3 times a day. So for anyone that I've treated for, let's say, 6 months to a year with antibiotics and they're still having joint pains, I often will wind up continuing the curcumin that I've already been using to lower inflammation. And I usually will wind up adding some glucosamine sulfate, 500 milligrams, 3 times a day to that. Okay? All right. Now, if you're going to do the glucosamine sulfate, you need to give it at least 2 months to see if it's going to work. The other thing I recommend, because there's just a lot of garbage products out there when it comes to glucosamine sulfate, is do yourself a favor. If you're going to try it to see if it makes a difference, get a high quality product. And I suggest a Thorne product, their Thorne glucosamine sulfate. It's got a track record of the company putting in it what they say is supposed to be in it, and of it actually having some success working too. Okay? All right. Thanks for that question, and good luck. Hello, Kristen. Let's see. My 19-year-old daughter has Lyme, Bartonella, Babesia, and Mycoplasma. We assume since September of 2019. She struggles to breathe all day and night, though her pulse ox reads 100%. Her trough, her throat, I think, and esophagus feels constricted, swollen every time she eats, no matter what she's eating, but doesn't appear to be an allergic reaction. Is this a histamine response, and should we consider giving her Benadryl to give her relief? She is very sensitive, so I'm thinking half a 25 milligram pill. She has not eaten a proper meal in over a week and only eats once a day. What can we do to help her? All right, a couple thoughts, and these are things I think you're going to need to explore with her physician as well too. So throat pain and difficulty swallowing can be, at least for a couple reasons. One is if she has developed acid reflux, acid coming up from her food pipe into the back of the throat, that's going to be very irritating. It could lead to swelling and inflammation and even a raw feeling back there. People that get acid rolling up from their stomach into their food pipe do not always have acid taste in their mouth, but if she does, then that's something to consider. And even if she doesn't, it's still something to consider. The other thing that can lead to a lot of irritation and inflammation in the back of the throat like this is having too many yeast in the intestines and in the intestinal system, okay? So in terms of that, things to consider that might indicate that she's got yeast overgrowth in her intestines, maybe even in her food pipe, and leading to rawness even in the back of her throat, would be increased sugar cravings, increased intestinal gasiness and bloating, possible vaginal itching, vaginal discharge. Sometimes if you have too many yeast in the intestines, they release toxins that get absorbed into the bloodstream. Those toxins then go to the skin, and it can lead to more pimples and acne, for instance, too. So that sometimes can be a sign of that too, okay? But it sounds like there's a couple of things that might be going on, and I think this is something you're going to need to talk to your healthcare provider about, okay? All right. Good luck. Hello, Joyce. Let's see, hi, Dr. Ross. In 2016, I was diagnosed with Lyme and Bartonella. I was on minocycline and Plaquenil for a few weeks, and then on herbal remedies, pulsing, MC-BAB, and Baluchi, and Cryptoplus, and serapeptase for a couple of years. When I stopped, those symptoms returned. Now on Sida acuta and Hutania, I read in your site you should treat Lyme before co-infections. Should I have started Otobabark and cat's claw first? Please speak on this. Thank you, as ever. All right, so a couple comments. Number one, I do not like pulsing antibiotics for Bartonella and for Babesia, whether they're herbal antibiotics or prescription antibiotics, okay? It is okay to pulse for Lyme, but not, in my opinion, for Bartonella and Babesia. All right, let me talk about that. So Lyme, the Lyme germ, the Lyme infection, replicates about every 4 weeks to every 8 weeks. It is an extremely slow-growing germ. So with Lyme, it is okay to pulse your antibiotics where you start and stop because it's not going to grow back fast, okay? On the other hand, Bartonella replicates every 24 hours, and Babesia is in the same, is about the same rate as well too. Meaning, if you take something for 2 weeks and then you stop it for 2 weeks, during those 2 weeks that you're off the thing you're taking for Babesia or the thing you're taking for Bartonella, it has a chance to grow right back, all right? So I know a number of my colleagues are pulsing for those, but boy, I find numerous times where somebody comes to see me that they've seen another practitioner that was pulsing their Bartonella or their Babesia antimicrobials, and they were not getting better or they're relapsing the minute they stop. and all I did was to put them on continuous treatment, and that took care of the problem. Okay? All right, so that's one comment I want to make about that. All right, in terms of what you wrote down here, the MCBAB Crypto Plus would have been agents that would have worked against Babesia, not Bartonella. So in the past, even though you tested positive, the herbal remedies would not have done anything for Bartonella. The minocycline could have, but by itself is probably not strong enough, okay? Usually I like to use it coupled with another intracellular antibiotic. So if I critique your previous treatment for Bartonella, I don't think it was strong enough, and the herbs did not do anything for that either, okay? All right, now, regarding my comments about what do you treat and in what order. So what I suggest, and I'm not sure that you had a clear understanding from what you read on my website, I say that you should treat Lyme and pick one of the co-infections while you treat the two simultaneously. So treat Lyme simultaneously with at least one of the co-infections. Once you clear one of the co-infections, then you move on to the next co-infection while you continue to treat the Lyme, okay? That's the process that I usually use with good success in my practice as well too, okay? All right. Thanks for the question, Joyce, and good luck to you. Hello, Chris. Hello, doctor. Thank you for all the information. It has helped me tremendously in my Lyme and co-infection journey. Good. I'm glad to have helped out. I would like to know how long after taking artemisinin does the Herxheimer reaction last? Thank you. Chris posted a second part I was reading from there. Okay. All right. So a Herxheimer reaction often is going to last anywhere from about a week up to a month. I rarely see it go longer than that. And usually it's going to subside within a week to 2 weeks. Okay? All right. Good luck, Chris. Thanks for the question. Let's see, S. If the oil of oregano is in olive oil, does that make it liposomal? The answer is no. Liposomal means that you take, not just mix the oregano in olive oil, it means that it is microscopically wrapped by the oil. And so they're different products. Mixing together is not the same as being fully liposomal. All right? Thanks for the question. Hello, S again. Let's see. Hi, Dr. Ross. Any suggestions for skin problems, manifestations from BART, face, stretch mark, breakout to use topically in addition to internal treatment? You know, I have not found anything useful topical to help with some of the skin manifestations of Bartonella, unfortunately. So I don't have a good recommendation for you on that. Hello, Doug. Let's see. Hi, Dr. Ross. Thank you for hosting these very helpful sessions. You're welcome. So I have a family member who feels severely fatigued and weak in addition to already being diagnosed with Lyme and other pathogens, wants to test for toxins. What kind of test, for example, heavy metals and other toxins, should be included? And do you have a favorite lab that tests for toxins? In treating toxins, can you describe chelation and any negative side effects? She also wants to test for cell damage. Is there a test you can recommend? So I'm not aware of a test to test for cell damage that is reliable. Okay. Regarding testing for toxins, the two that I would suggest testing for if she's having marked fatigue, one is mold toxicity. And the lab that I like using for that is Great Plains Lab. Great Plains does a urine mycotoxin test, which is looking for a mold toxins, okay? The other test that sometimes can be helpful is to do heavy metal testing. The way to do that, though, is a urine test, and the best way to do it is after you're first given a chelation agent that you take for, and then collect urine for 6 hours. The chelation medicine I like to use is a prescription chelation medicine called DMSA. So she would need to work that out with her health provider. In terms of doing other toxins that could impact her health, I generally find limited benefit from looking for those or doing anything for them. And so I'm not going to address those, okay? The big things I find benefit from mostly is in looking for mold toxins, and if they're there, removing them. And then secondly, sometimes there can be some benefits that occur from dealing with heavy metals as well too, okay? All right. Thanks for our question, Doug. Oh, in terms of heavy metals, again, she's going to need to work with a doctor who can prescribe the DMSA, but the company's test kit that I like to use for that is a company called Doctor's Data, all right? All right. I'm going to do a quick screen share here, just show you a couple things. All right, so in terms of testing for heavy metals and why you need to do a provoked test with a chelating agent like DMSA, take a look at the article I've written on heavy metal toxicity. It's this one called Heavy Metal Toxicity in Lyme Disease. I do talk about testing in here too, okay? All right. In terms of mold toxins, what the problem is and why you would test for it, take a look at my article on mold toxicity. It's this one called Mold and Lyme Toxin Illness. You will see, I need to update one portion of this test, which is the section on urine mold toxin test. I used to use a lab called Real Time Labs. I still do use them, but because of cost issues now, I'm using this lab called Great Plains Lab that does the urine mycotoxin testing at about half the cost of the real-time test, okay? All right, thank you for that question. Hello, Sarah. Boy, I'm really getting hit by the light through this window. Just a minute here. I'm gonna reorient myself so I'm not getting blighted in the eye here. Let's see if that works a little bit better. I've got a little gap in my blinds through which the sun just keeps following me around the room here. So let's see if this works a little bit better. All right, let's see. Hi, Sarah. Let's see. What are the most symptoms that you see in your patients with Bartonella? Do you typically think of Lyme or Bartonella when someone has issues with short-term memory and brain fog? Thank you so much. So some issues of short-term memory and brain fog could fall into the Lyme or Bartonella camp, okay? Other symptoms that I consider when I'm trying to decide if somebody has Bartonella, and I just kind of look and see if there's enough of them there, and then I decide based upon the numbers of them as to whether Bartonella is there. So things that make me think about Bartonella is anyone that has a lot of psychiatric issues, you need to think about Bartonella. Bartonella is known to provoke and cause anxiety, depression, sometimes even hallucinations, okay? Bartonella also can lead to neuropathies and nerve injuries, so people with numbness, for instance, or people that have nerve pains, which would be sharp stabbing, shooting, burning, piercing, or electrical type pains. People that have rashes that look like stretch marks or scratch marks on their skin, those type of rashes can often be caused by Bartonella as well too, okay? So I will sometimes consider that as something that indicates Bartonella is there too, all right? And then sometimes people with Bartonella would get a lot of pain on the balls of their feet or the soles of their feet. And I have found Bartonella to infect part of the brain called the limbic system, which can result in people having symptoms of tremors or internal vibrating, I should say internal tremors or internal vibrating. And then lastly, sometimes people with Bartonella will have seizure or seizure-like syndrome as well too, okay? And not any one of those by themselves says Bartonella, but if there's enough of them going on, I'll decide to treat for Bartonella. If you need, so let me show you, if you want to read more about how I diagnose Bartonella, let me show you an article that I've written about that too. And I do a screen share for that. All right, so take a look at my section called How to Diagnose here. And take a look at this article about how to diagnose Bartonella in chronic Lyme disease. In here, I list out all the symptoms that you might want to consider. I also describe why testing is not fully reliable, okay? All right. Hello, Joanna. Let's see. Thank you, Dr. Marty. I really appreciate all you do for us Lymies. You're welcome. Let's see. Wondering what the best treatment for eye floaters, blurred vision due to Bartonella, although I also have Lyme. I do the Cowden, and it has helped a lot with symptoms like head pressure, vertigo, tingling in extremities, but now I have more cognitive issues and the eye cranial nerve issues. I like doing herbs, but I don't know if they are crossing the blood-brain barrier. Would you say antibiotics are necessary? Also, if I'm afraid to do rifampin, what other combinations could I try? Okay, so first of all, I don't have a good treatment for eye floaters. The treatment is to get your germs under control. So whether it's Lyme or Bartonella, you just have to keep killing them, basically, to get rid of them, okay? There is not a specific herbal or natural remedy that deals with just the issue of eye floaters. In terms of Cowden, I want to let you know Cowden is weak when it comes to treating Bartonella. His protocol has one herb in it that can work on Bartonella, and that's the Houttenia. I find actually the ideas that I get from Buhner herbs works better for this. And that is, Buhner has the idea that for treating Bartonella, that you need to do things to boost the immune system. And secondly, he likes using two Bartonella killing herbs, which are Siddha Acuta and Houttenia. In fact, I build a lot of that concept into my protocol. I actually don't like the Cowden protocol. I think you can do better. And I would suggest you might want to take a look at the Ross Lyme support protocol, which deals with how do you treat Lyme using the best two herbs for doing that, which is cat's claw and atova. Granted, Cowden uses them, but he pulses them in and out, versus I have found more success in just using them continuously. In addition, my protocol for Bartonella says to use Siddha Acuta and Houttenia, which I find to be more effective. Cowden does not have an adequate approach for dealing with inflammatory cytokines to suppress the immune system. The Ross support protocol does. Cowden does not do enough things that actually helps your immune system work better. The whole Ross Lyme support protocol does. So if you're trying to consider whether to go to prescription antibiotics, my first step would be consider a more thorough protocol. I don't think that the Cowden is adequate, actually. If you do want to go to prescriptions and you do not want to use rifampin for your Bartonella, you could look at doing a combination of Zithromax coupled with a tetracycline like doxycycline or minocycline might be an option for you too. Okay, all right. Let me do a quick screen share here. All right. So if you're wondering where the Ross Lyme support protocol is, take a look at this treatment protocol here. All right. And my protocol addresses many different aspects. All of them ultimately are designed to turn on your immune system. So number one, I talk about the importance of getting sleep, and I give you recommendations to do that. You want to get sleep because sleep restores the immune system, and sleep helps lower inflammation chemicals called cytokines. Cowden does not address sleep. Number two, I talk about a diet that I find to be most helpful. Cowden does not talk about diet. Number three, I talk about how to lower the excessive inflammation that you have in Lyme due to cytokines that suppresses your immune system, and Cowden does not address this at all. Number four, I talk about being on an adaptogen, which is ashwagandha, and I think recently Cowden has added one of those in. Number five, I talk about how to support your hormone systems. Cowden does do a little bit to address that. Number seven, I talk about detoxification. While Cowden may use berber and panela, I don't find that they are really that effective. I prefer to use liposomal glutathione. I talk about exercise. My whole protocol is designed to boost the immune system. And then my protocol addresses all the infections like yeast, like Lyme, like Babesia, and like Bartonella. When it comes to all of these, my protocol is stronger than Cowden is at doing the germ killing. All right. So you may want to take a look at all of this. All right. Thanks, Joanna. Good luck to you. Hello, Leanne. Let's see, hi, Dr. Ross. If my homocysteine level is high and I'm not getting better after hyperthermia, antibiotics, and Babesia treatment, would you assume that I have MTHFR? I detox every day with either coffee enema, Epsom salt baths, lemon water, and glutathione infrared sauna. Should I start on a treatment to help my detox pathways? I have seen your protocol for this. Many thanks again. All right. So first of all, one comment. In terms of hyperthermia, I have a lot of people that fail, that have been to the German clinics and others that do hyperthermia, and I see failed treatments all the time. Their claim that they make that it gets rid of every germ that is in you is wrong. It does not always work. And in fact, I see often people have regular treatment failures from it. So if that is what you have, so keep that in mind. And then it looks like you have used antibiotics and Babesia treatment. If you're not getting better, you may need to relook at all those as well too, okay? All right. Secondly, regarding MTHFR, many of you may be aware I rewrote my article on MTHFR detoxification defect, or actually refilmed it. I guess it was a video article, and I released that earlier this week, or sent out email notification about that. So let me talk about that real briefly. So MTHFR is a genetic defect, and what MTHFR stands for is methytetrahydrofolate reductase. What that is, that's an enzyme. And that enzyme is responsible for taking diet folate and converting it into an activated type of folate called a 5-MTHF. You need that activated folate as a first step in a detoxification pathway called the methylation detoxification pathway that ultimately produces the master detoxification chemical we use called glutathione. Now, there are numerous chemical reactions that ultimately produce glutathione, and each one of those detoxification reactions that ultimately lead to production of glutathione do a little bit of detoxification too, okay? Now, we have the ability to see if you have genetic defects that may make it so the MTHFR turns out defective, that this enzyme turns out defective. And if the enzyme turns out defective, that'll make it so you don't produce enough of the activated folate, which then make it so that you don't have adequate detoxification reactions, and ultimately you don't have enough glutathione in you, okay? All right, so my point in the recent article that I released is that it used to be we would look for the defects, and if you had a genetic defect, we presumed that you had methylation problems that you could not detox correctly. That is probably an incorrect viewpoint, because even though you may have a genetic defect, it doesn't mean you manifest the problem, all right? So having an incorrectly formed enzyme does not necessarily mean that there aren't other ways the body can correct the problem. And what I propose in that recent article is that all the bacteria and germs that we have living in our intestines, that we let them live there to correct our problems. So we have, about 90% of our body's genetic material is actually from the bacteria and organisms and parasites and viruses that inhabit our intestines. So we let a lot of stuff exist in us, and they exist there because we let them, because we get something from them. One of the things we get from that good gut microbiome that we have is it helps with detoxification. One thing it does is it helps with digestion. One thing it does is it removes things that we might be allergic to. And also it fine-tunes and regulates our immune system. If we do have an incorrectly formed MTHFR enzyme because we have genetic programming errors, it is possible that all these bacteria and germs in our gut produce the methylated form of folate that we need, and we never need to take a supplement that does that, all right? In other words, our gut may make up for the problems we have, okay? So what I proposed most recently in my article is, instead of treating for the genetic MTHFR defect, instead of testing for it and treating based just on genetic abnormality, was to see, do you really have a functional problem? Do you really have something that indicates true blockage in your detox pathways? And so one of the things that we can measure is a homocysteine level. So if you do not have adequate methylated folate, the next step in the detoxification pathways would be to transform homocysteine into a chemical called methionine. And if you don't have enough of the methylated the activated folate, you're going to have a buildup in levels of homocysteine, okay? And so what I proposed is, if you have homocysteine levels that are high, that's when you correct for an MTHFR. It would be okay, actually, to go ahead and, if you have elevated homocysteine, not to do the MTHFR genetic analysis for the genetic SNPs, but rather just assume that that's what you have going on and start the methylated folate that I mentioned in that article, okay? So Leanne, I know that's a long discussion, but I want to make sure that everyone here was on the same page in terms of that problem, all right? All right, I'm going to show everyone that article if you haven't seen it yet, so you can go and look at it. Or I even describe what supplement you would use if you have the true problem with elevated homocysteine, all right? Let me do a quick screen share here. All right. So again, this is one of my recently published articles. Take a look in this section called The Latest. And here is my updated article on MTHFR, okay? All right. If you do have the problem, you have elevated homocysteine, you could take a look at the section down here about what do you do to correct it. If you are looking for a source for these supplements that I mentioned here, you could take a look at my supplement store, which is Marty Ross MD Supplements. Anything I talk about supplement-wise or you read about in my Treat Lyme website, you can find my recommended supplements here. The store is open for anyone to use, okay? All right, and this is located at treatlyme.com. All right, Leanne, good luck to you. Thank you for that question. Hello, Brandy. I see, can Lyme or BART be spread via breast milk? There is no proof that either one of them can be. In other words, we do not have any science that says they can be. There is some anecdotal evidence, meaning we see women that have it and suddenly their children have it, that suggests that Lyme can be spread through breast milk, although I think it's awfully hard for it to be done because I think most of it gets destroyed by the gut acid. Regarding Bartonella, I don't consider it to be spread via breastfeeding. Hello, Brandy. Let's see. Where do I start to see if my 9-year-old son has Lyme? We live in Georgia, and his pediatrician suggested seeing a dermatologist. What do you recommend? So I would try to find somebody that is a Lyme literate doctor, somebody that treats Lyme disease, okay? And to do that, you might get a hold of, I don't know who's available down where you are, but the way you could find that out would be to reach out to ILADS, which is the International Lyme Associated Diseases Society. Their website is at ilads.org. That's ILADS.org. Go to the contact page, and through the contact page, there is a tab you can click that is something you can click that will help you identify a physician in your area, okay? Short of doing that, the best testing to see if you might have Lyme would be to get testing through IGeneX. And I prefer to do these days a test called their immunoblot for Lyme. It's an IgM and IgG immunoblot test, okay? All right. But I would suggest you reach out more to a Lyme literate doctor who can help walk through this as to whether your son does or does not have Lyme, somebody that's used to treating Lyme disease, okay? All right. Thanks for the question, Brandy. Good luck to you and your 9-year-old son. All right. All right, everyone, that's it for me for tonight. Enjoyed spending the last hour and a half or so here with you. Keep an eye out on your email tomorrow morning. You'll get an email from me saying that the recording is ready to be viewed. And that should be somewhere around 8:30 to 9:30 in the morning, Seattle time. Also through that, you can click on a link to sign up for the next 2 webinars as well too. I have a request for you. If you are getting benefit from this, please spread the word. The more people that you share my emails with about this, the recording of the emails, and even the invites that I send out, would be more people that sign up and get this kind of information. I want to help as many people as possible, so I appreciate if you'd share this information. And good to see everyone tonight. I look forward to seeing you next week, and I hope everyone has a good week. Bye-bye.